My name is Dr. Carissa McCauley. I'm one of the audiologists here at Rutland Regional Medical Center. We are just going to go through what you typically would experience whenever you're being fit with a new set of hearing aids. You'll see them in a box similar to this. It'll come with its case, and inside we'll find the hearing aids that we would be fitting. It comes with instruction manuals on how to take care of it. That way you don't have to try and remember everything that we cover in the initial appointment. It comes with little cleaning tools to help clean them. So we put them in your ears. We program them specifically based off of the hearing tests that we have for you. It's kind of like a prescription. It's similar to glasses, but for hearing aids. We go over how to take care of them, what to expect the first few days that you have them, make any adjustments that we feel are necessary based off of your needs specifically. And then we see you back in a couple of weeks after you try them out in the real world. You come back, give us feedback on how things went, what situations were good or bad, and things that we still need to adjust. So it's not an instant, hey, this is what it is and it's perfect. We like to have a little bit of real world experience so that we can, fine tune them more specifically for the environments that you find yourself in. One of my favorite ones, I had a gentleman come in who had increased difficulty hearing his grandchildren, and he watches them, a couple of days each week, so constantly around the family, and they felt bad. They kept saying, I can't hear you, you're gonna have to speak louder, you're gonna have to speak louder, and it got to the point where everyone was frustrated and he was missing out on the fun moments. So him and his wife came in, he was fit with hearing aids. He went home for the first 2 weeks and he came back, he goes, this is amazing. He goes, I don't think I've heard this well in years. I didn't know what my grandchild sounded like. He broke down, I broke down. I saw him again a couple weeks later and he goes, I can hear the turkeys. He's a big turkey hunter. So he's one of the ones that sticks with me because, it was, family life was so important to him, and he got that back, which was enough for him. And then a few weeks later, he realized that he was able to hear the turkeys again while he was out hunting with his friends. So it's making all aspects of his life a little bit better. So in regards to a hearing test, it's not going to hurt you. If nothing else, you come in and your hearing is still perfectly normal, and we get to tell you, hey, your hearing is great. Be careful in the presence of excessively loud noises. We'll see you in again in a couple years, or if you start to notice that you're having trouble. And then that gives us a baseline. So even if the hearing's normal, in a couple years it might not be. So we can see how much has it gotten worse over time. That way, if it seems like it's jumped down and decreased a lot, we can see if there's medical interventions that need to be completed. It doesn't hurt. It's kind of like having an eye exam, everyone should have it, then you can monitor to see where you're at. Here at the Audiology Department of ENT and Audiology, we have 3 audiologists on staff who are here to assess your hearing ability. We are able to provide you with hearing aids if that is needed. We also offer diagnostic testing for hearing, as well as vestibular testing for people that are experiencing dizzy and balance disorders as well. So we offer a lot. We have a hearing insurance specialist on hand who is also able to help on the hearing aid side of things. So if things are broken or we need help with repairs, she's also able to get them completed so that they are back to the patients in a more timely manner. We have 2 locations. In Rutland, we are located at the Thomas Huebner Medical Office Building on the 2nd floor. In East Dorset, we are located at the East Dorset Medical Campus. That way, if you are in more southern Vermont, we have a location that is closer to you.